what will go down in history as the greatest reform in healthcare. 50 years ago, millions of Americans have been faced in the flames of withering healthcare onslaught. With price variations, lack of competition, and transparency. "100 years later, Americans still are not free from the shackles of healthcare. 100 years later, Americans still lack coverage for pre-existing illnesses. 100 years later, Americans live in a lonely island of managed care, so-called managed care. One day, this nation will rise up, live out of the true meaning of its creed. Americans always chose to be self-evident and self-righteous, that every American will be able to handle their health care better than the government can. One day, this nation will rise up, live out of the true meaning of its creed. Americans always chose to be self-evident and self-righteous, that every nation will be able to, everyone will be able to handle their health care better than the government can. I have a dream. If American loses their job from automation, there's a talk of $1,000 mandatory salary. If that's the case, 1/3 of it should go to the health savings, so they can use it for their health, nothing else. I have a dream that one day, even the states of states will make health savings accounts to keep, not just for a year, to keep it for a lifetime, across the generations, transform healthcare into oasis of affordability, competition, and transparency. I have a dream American will live in a nation where they will not be judged by their economic status, but judged by their health and fitness. I have a dream that one day down in America will demand the access of care through consumer-controlled health savings accounts across all spectrum. All Americans will be able to work together, join together, resolve together, go into the uncharted waters together, access of healthcare together. Let healthcare access ring. For America to be a greatest nation, this must become true. This must become true. Let healthcare access ring from the colossal hilltops of New Hampshire. Let healthcare access ring from the mighty mountains of New York. Let healthcare access ring from heightening Alleghenies of Pennsylvania. Let healthcare access ring from snow-capped Rockies of Colorado. Let healthcare access ring from the curvaceous slopes of California. Let healthcare access ring from stony mountains of Georgia. Let healthcare access ring from the Lookout Mountains of Tennessee. Let healthcare access ring from every hill, every state, from every city. Americans will be able to speed up that day. That we'll be able to join hands, sing in the words of American healthcare at last, with customers in the front line. Not the insurance companies, not the government, like we have never seen before in healthcare. Free at last from co-pays and deductibles, denials and rejections. Free at last from pre-existing illness coverages. Free at last from the outrageous medical bills, from all services. Free at last from all bankruptcies. Free at last where Americans get to choose their own doctors and hospitals. Free at last to shop, save money in healthcare for a long haul. Free at last with the health savings for a healthy life. Free at last from the health maintenance organizations, so-called HMOs and PPOs. One day, technology will pave us the way into the future, where America will be number one healthcare provider. As Ronald Reagan said once, America will be a shining city on the hill forever. Thank you. God bless.
That was very intriguing. But what about the questions?
Yes. Again, we can get. I just need a general input to see if there's anything for improvements. I know I don't have a deep voice like Martin Luther. He has such a deep voice. It's hard to recreate the same. But with whatever emphasis on healthcare. Bottom line is, did you guys feel anything at all?
Yes. At first, no, but then by the end of it, I was like, you know what? Yeah.
Yes.
One thing though, the speech is a good talk, but for the contest, it's supposed to be an inspirational, uplifting talk,
Yes.
not kind of on, I don't know whether that going on medical care is. I don't think it would.
It is something to do with
I know there's something wrong with the medical care, but
No. It's inspirational. That's what my main message is. The content is not important.
yeah.
Content is irrelevant. But we are talking about inspiring people. Is this inspiring or not? If it's not, then there's no reason to even go there. But my goal is to inspire people. Content is irrelevant. You can talk about content you can talk about Martin Luther King forever. And people like Martin Luther King, people